Specimen Preparation. Setting: operating room. Materials: assortment of specimen containers with cover, including envelopes large and small, labels, permanent pen, request form, gloves, Petri dish, solutions, 10% buffered formalin, 95% alcohol, plain NSS. Welcome to the Specimen Preparation module. A specimen is anything surgically removed from the patient, be it soft tissue, bone, or foreign body. Improper handling of specimens may jeopardize the patient's life. Improper handling of specimen may lead to a mistaken diagnosis, a delay in treatment, or another operation. To minimize error, several measures are to be taken. This includes the following. 1. Correctly identify the patient. 2. Correctly identify and confirm the specimen by the surgical team. 3. Placing the specimen in an appropriate container and preservative. 4. Correctly label the specimen. 5. Complete the pathology requisition slip. 6. Transport the specimen to the pathology department. First, proper labeling. Make sure that the specimen container is labeled properly. The label should include date specimen was taken, complete name of the patient, age and sex, source of the specimen, hospital number or PIN. This label should include 2 unique identifiers: the name of the patient and the hospital number. Second, complete request form. In the hospital, the request form looks like this. The essential contents of the form are the following: date, patient's name, birth date, age and sex, civil status, pathology number, ward number, case number, physician, pre-op diagnosis, post-op diagnosis, source of specimen, brief clinical summary, date and time of receipt of specimen, signature of person submitting specimen. Third, one should select the appropriate container. It should be the right size, provided with a lid that completely seals and preferably not transparent. The first 2 steps, label and request form, can be done even before the operation starts. After the operation, when the specimen is to be handled already, the intern is still wearing his or her OR attire. Handling the specimen. Once the operation is done, you prepare the specimen for transport. The third principle is to use appropriate containers and solutions. Containers should be of appropriate size to accommodate the specimen so that it can be totally submerged in the solution. Preferably, the container must not be transparent and is provided with a tight lid as cover. Once you have selected the appropriate container, you place the prepared label to the side of the body of the container, not on the lid or in the bottom. You then place the appropriate solution into the container first. specimen should be placed in the container already containing the appropriate solution. The solution should not be poured over the specimen to prevent splashing. In placing the specimen into the container with the appropriate solution, it should be handled gently by gloved hands. If possible, refrain from using instruments to avoid crushing the tissues. If you should use an instrument, use a traumatic tissue forceps. After placing the specimen in the container has to be covered and sealed to avoid spillage during transport. The appropriate labeled specimen must be submitted to the pathology laboratory together with a complete request form and submitted to the authorized laboratory personnel and entered into the logbook. Certain procedures require that specimens should be processed fresh. This includes those submitted for frozen section. These specimens must not be placed in any preservative. Once the specimen for frozen section is removed from the body, it is immersed or moistened in normal saline and immediately brought to the laboratory for processing without undue delay. Fine needle aspiration cytology, core needle biopsy, foreign body in situ, medico-legal cases. Core needle cytology.